What is asbestosis? Asbestosis is a lung disease that occurs in people who inhale asbestos fibers and dust over a long period of time. Asbestos is a mineral that forms tiny and long-lasting fibers. When asbestos fibers and dust get into your lungs, they can cause fibrosis, thickening and scarring of the lungs. Asbestos can also cause the membranes surrounding your lungs, the pleura, to thicken. This scarring and thickening of lung tissue can make breathing difficult. In some cases, asbestosis can lead to life-threatening complications, including lung cancer and heart failure. In severe cases, asbestosis can be fatal. Who is affected by asbestosis? You're more at risk of getting asbestosis if you have long-term exposure to asbestos. This is true if your job involves handling materials containing asbestos. These types of jobs include 1. Asbestos miners, installers or removers. 2. Auto and aircraft mechanics. 3. Construction crews. 5. Railroad and shipyard workers. Symptoms and causes. What are the signs and symptoms of asbestosis? The first symptom of asbestosis you might notice is having trouble breathing, being short of breath, especially when you're working hard or exercising. Other signs and symptoms may include 1. Chest pain and tightness. 2. Clubbing of your nails, large, rounded fingernails and toenails. 3. Cough. 4. Crackling sound when inhaling. 5. Fatigue, extreme tiredness, and trouble exercising. 6. Unintended weight loss. What causes asbestosis? The main cause of asbestosis is inhaling asbestos fibers or dust over a long period of time. This leads to the thickening and scarring of your lungs and pleura, very thin tissue, or membrane, that line your lungs. Building and manufacturing industries used asbestos widely in the past. As a result, some people developed asbestosis after repeatedly inhaling asbestos particles while at work in these industries. Materials and products that may contain asbestos include 1. Car clutch pads and brake linings. 2. Construction cement, putties and plaster. 3. Insulation. 4. Pipe wrapping. 5. Siding and roof shingles. 6. Vinyl floor tiles. Diagnosis and tests. How is asbestosis diagnosed? Your healthcare provider will examine you and ask about your medical history. Remember to tell them about your exposure to any harmful substances like asbestos. Your healthcare provider may also order tests to complete the diagnosis. These might include 1. A chest X-ray. 2. A computed tomography (CT) scan. 3. Lung function tests like spirometry. Management and treatment. How is asbestosis treated? Treating asbestosis aims to manage symptoms and preserve function in your lungs. Your treatment depends on the severity of the disease. Your options might include 1. Oxygen therapy. Receiving extra oxygen through a mask or tube in your nostrils help you breathe more comfortably. 2. Pulmonary rehabilitation. Exercises and behavioral changes can improve your daily functioning. 3. Lung transplant surgery. In rare cases, a new, healthy lung from a lung transplant can relieve symptoms and prolong life. What can I do at home to manage the symptoms of asbestosis? To make things easier on you if you have asbestosis, you can follow a healthy lifestyle by 1. Not smoking. 1. If you do smoke, get help quitting. 1. This is probably the most important thing you can do. 2. Avoiding breathing air contaminated with allergens, pollution or second-hand smoke. 3. Avoiding sick people and practicing good hand-washing hygiene. 4. Drinking lots of water. 5. Eating a healthy diet. 6. Exercising regularly after discussing an exercise plan or routine with your healthcare provider. Prevention. How can you prevent asbestosis? You can reduce your risk of asbestosis by avoiding long-term exposure to asbestos. If your job involves exposure to the mineral, you should wear a respirator, a mask that filters particles from the air. This protective mask keeps you from inhaling asbestos fibers or dust. If you know you've had asbestos exposure, you should have regular exams and chest X-rays. These tests don't prevent asbestosis but can help catch it early. If you've been exposed to asbestos and you smoke, quitting smoking is your best way to reduce your risk of getting cancer. Difference between asbestosis and mesothelioma. The main difference between asbestosis and mesothelioma is that mesothelioma is cancer and asbestosis isn't cancer. The disease of asbestosis remains in your lungs and pleura, the covering of your lungs. Mesothelioma begins in the tissue of your lungs and abdomen. It can spread throughout your body. Having asbestosis doesn't mean you won't have cancer. It's possible to develop lung cancer or mesothelioma later on. Comment below if you know something extra because it will be very beneficial for us. At the end it is requested to please subscribe our channel.